So my name's Dawn Casey, and I'm Tuckala tribal group from North Queensland in Croydon. I've lived a lot of my life in Canberra. I'm the Deputy CEO of NACCHO. I joined NACCHO just nearly 4 years ago. My previous jobs, and the last time I think I spoke to CareerTrackers students was a few years ago after I'd left the Powerhouse Museum. So I've been the director of the Powerhouse Museum, the director of the Western Australian Museum, and I built the National Museum of Australia. And it's interesting, I just talk about that National Museum because museums, I advocated, were a safe place to discuss unsafe ideas. You can come there to those places and you can debate issues and that you can't necessarily do out in the open or freely out in the open without being attacked. So COVID-19 reminds me, not being unsafe, but it reminds me a bit of this is something really unusual that's happening. So NACCHO in January were advised, we have 144 members around the country of community-controlled health services around the country. We have colleagues in each state and territory called the affiliates. And for the last few years, with Pat Turner at the helm, we've been advising government on a whole range of areas and much more advice going to ARCHOs across a whole range of health issues. So we were court advised in January about the issues around COVID, what was happening, and we were able to get that information direct out to community control health services. Then several weeks ago, a joint task force or advisory committee was established with the Department of Health, and I co-chaired that advisory group. And Jason has joined us in the last couple of weeks, so he'll talk about some of the clinical bits. But what's quite interesting about COVID is you've heard all the messages to keep safe, stay home. It's really difficult sometimes to do that. You shouldn't worry too much. I mean, your students and they say that the younger cohort is, doesn't have as much to worry about as older people like myself. Jason's smiling. What's really interesting and important is you can use the time that you're home, not to be worried, but to catch up on your studies. I get calls all the day from family. You can reassure them. There's many of our families that all of a sudden are out of work, but the government, there is funding for that. The issues that we're dealing with at the task force is not just health. Department of Health set up the task force, but we now find ourselves dealing with issues like food security for people. We're involved over the last couple of weekends for the close down of communities like all of Northern Peninsula and Queensland, the Territory, Western Australia, top end of South Australia, have been closed down by biosecurity instruments signed by Minister Hunt. And this was at the request of Aboriginal and Torres Strait Islander people themselves who wanted to keep their communities safe. So people began last week going back home from cities like Darwin, back to Western Australia, from Alice Springs to the top end of South Australia. So it's involved not only pure health issues that we're dealing with, but a range of other associated issues. We lobbied for the compliance for CDUP to be loosened. That's occurred. The government, not entirely up to us, but we certainly lobbied strongly that the government increase New Start. That's occurred. So what the government's doing is, in all the changes that they've been doing, is to try and make the community feel safe, feel that they haven't got to worry too much, albeit if you haven't got a job, of course you're going to worry, but if you go up to Centrelink, they've made it really easy for people to go on whatever it's called, the dole. I had a brother who's worked for 40 years and all of a sudden he's out of a job and never, ever wanted to go to Centrelink, but went up there last week and it was remarkably easy for him to sign on, and he'll hope that he's got his job at the end. So whilst it's it can be traumatic for some people, especially if they've managed, if they've got the disease, and Jason will talk more about that in a minute, all that stats. It's also a time to just stay safe and follow what people say, but it's also a time to take note about what's happening around and how it influences you and what you can do in looking through all of the issues, and how does it help you with your studies, and what would you be thinking about doing after your studies. And it's also important to keep in touch with your colleague students, and this is fantastic that Trackers is doing this. So hopefully there'll be many more of these sessions. But I might now, and I'm open later to any sorts of questions you might wish to ask, but I might now hand over to Jason, who can talk a lot more about the clinical side of
it. Thanks, Don. So I'm Jason. I'm a GP and an epidemiologist. I'm non-Indigenous, but I've worked for the community for over 10 years, predominantly in the Aboriginal community-controlled health sector. I have a few jobs. I'm a GP at Guruni-Ilamaka, which is the health service up in Yarrabah, and I'm a medical advisor here at NACCHO. But that's a new job. Until 2 weeks ago, I was in an Aboriginal and Torres Strait Islander health unit within the Australian National University, looking at how we better improve prevention of cardiovascular disease, and working with people like Ray Lovett, who people might know around the Mike Hawaii study on culture and health. But then when the coronavirus outbreak happened, I hit up Dawn. I was doing some work for NACCHO, and I just thought, being a GP and an epidemiologist and someone who's worked in community for a while, I could be of help. And so here I am, which is great. So I guess people are probably going to have a lot of questions about coronavirus, and it might be best to let the questions come in and see what it is. There's a lot of information out there that's been spread by the government, but also through a whole bunch of other channels. Just to state, the difficulty about coronavirus is that there is no natural immunity to it in our society. So for most diseases that we encounter, some people are immune because they've had it at different times of their disease, or they've had another illness that was similar that provides them with some immunity, whereas coronavirus doesn't do that. So for all of us, we're fighting this bug for the first time. It's in its some people at early stages, people like Donald Trump said that it's no more deadly than the flu, but the fact is it is, and so it does kill significantly more people than the flu, and that risk gets bigger the older that you are. So if we look at children under 10, there hasn't been any reported deaths amongst children under the age of 10. Whereas when we get to people that are over 70, around 5% of people die with the disease, and it gets higher when people are above 80. So the other thing is that a lot of people need to go on to, if they don't die, they need to use a ventilator within an intensive care unit. So there's a big concern about how much we'll have to do that. So here at NACCHO, I sit on the Aboriginal and Torres Strait Islander COVID-19 advisory group with Dawn, and I also sit on the group it's called GP Peaks. So it's NACCHO and then the College of General Practitioners and the Australian Medical Association, and we report to the Principal Medical Officer. coming here, one of the things that's really informed a lot of what we're trying to do is my experience in Yarrabah. A couple of years ago in Yarrabah, there was a outbreak of mumps, which is something that most people are immunised against, have a vaccine for. But there was a strain of mumps that wasn't covered by the vaccine. And mumps is a little bit similar to coronavirus in that it's spread by droplets, and that it can have a period where you've got the disease but you're not showing symptoms. And what we found was that it spread really quickly through the community. And we saw my colleague, Bobby Ma, who's a Aboriginal from WA, who's an epidemiologist. She went up there to investigate, and we found that the really problem was about isolating people. We were sending people back home to the overcrowded homes in Yarrabah, and they spread it through their families. So we're spending a lot of time here at NACCHO trying to work about how to safely isolate and quarantine people so that they don't pass on the infection if they do get it. And the other thing Bobby found when she was there was just really that the local community, the Aboriginal and Torres Strait Islander health workers, were really the essential people for doing things like contact tracing and educating community about how to decrease transmission. So I was just on the phone with the Department of Health today to talk about how we train up our health worker workforce to do contact tracing and things like that if coronavirus does get into communities. So yeah, I guess we'll leave it there. There is a lot of things to talk about with coronavirus. Dawn and I were talking about how quickly things have changed in the 2 weeks that I've been here. If we think about it, in 2 weeks that I've been here, and I'm not saying I did these things, this is what's changed, but we've gone from sort of vague advice about social distancing to now there's 2-person maximum for public gatherings. The number of communities now have travel restrictions in place. A number of state borders have shut down. For general practice, basically you're allowed to do everything via telemedicine now. And that's all happened in a 2-week period. So it is amazingly quick changes are happening here that they needed to try and prevent the spread of the disease. So I'll stop there and go to Adam.
Thanks, Jason. Thanks so much, Dawn. For those of you who don't know me, my name's Adam Davis, and I'm the Director of Learning at CareerTrackers. So I've the task of just moderating a bit of a Q&A here, and just like to remind everyone, if you've heard anything that was already discussed that you'd like to be expanded on, feel free to leave a note in the comment section, or if you have a direct question, please ask that in the comment section, and I'll make sure that everything gets addressed in time. The first question that I thought I'd open with, and it relates to one of the questions asked already in the chat, which is, have you seen any sort of common misconceptions or myths permeate through Indigenous communities with regards to the coronavirus? So a really broad question, but then specifically, someone's asked this question that there's been mixed information in Aboriginal and Torres Strait Islander communities around who is susceptible at contracting the virus, with the idea that Aboriginal people are more susceptible or at risk of serious complications. So, for example, if you're Aboriginal and you live in the city, you're young and have no other medical conditions, are you at more risk than a non-Aboriginal person of the same demographic?
You happy for me to answer that, Dawn?
Yeah.
Yeah, look, obviously we've had very few Aboriginal and Torres Strait Islander people contract coronavirus at the moment, which is great. In terms, so there's a few things in there. One was about misinformation. The main misinformation that I've heard is just sort of, there was a story published in the Daily Mail over in the UK talking about body bags, getting shipped into communities and things like that. And that's just not true, What's happening is that a whole bunch of Aboriginal and Torres Strait Islander leaders are coming together in this advisory group to create strategies specific to Aboriginal and Torres Strait Islander people. In terms of susceptibility, again, we don't have specific data for Aboriginal and Torres Strait Islander people. There's nothing to suggest that being Aboriginal and Torres Strait Islander makes you more susceptible to the disease. What makes people concerned is that Aboriginal and Torres Strait Islander people are more likely to have the chronic diseases that are associated with worse outcomes for coronavirus. So if we think about something like diabetes, people that have diabetes have a higher death rate from coronavirus than people without diabetes. And we know that diabetes can often start much earlier in young Aboriginal and Torres Strait Islander people. I have people in Yarrabah who are teenagers that have had diabetes and type 2 diabetes. And so, the concern is that because there's these comorbidities like diabetes, like heart disease, that increased rates in the community, that people would have worse outcomes because of that. It's got nothing to do with their Indigenous status.
Okay, so another question that came up in the chat here was that for those who are living away from home, especially with the Easter holidays coming up, is there any recommendations for travelling and visiting family in communities where there's high Indigenous populations, like now and perhaps in the future as well?
Yeah. So each state and territory has its own rules brought in about crossing borders. So you need to check out what's happening if you're traveling interstate around that. And then there's the travel restrictions that were brought into specific communities, and so with those restrictions, it says that non-essential services need to wait for 14 days before they can enter the community. There's also, within the statement there, it says that the government will provide accommodation if they have no other alternate accommodation to stay in. And that's just about trying to keep these communities free of coronavirus. At the moment they are. We haven't had a reported case of an Aboriginal and Torres Strait Islander person in these remote communities having coronavirus. And by having a 14-day quarantine, that keeps it from occurring. So, for people that don't live in remote communities that have travel restrictions, but just going to, if they live up in Cairns or wherever, you know what I mean? It's a sort of this difficult personal decision you got to make, for people that are in Sydney, there's quite well-established community transmission, especially in certain periods around places around Sydney. And so, you got to think about what's the risk of you potentially bringing that into that community. But the safest thing is this 14-day quarantine.
Another question here is, and this may be more sort of a legal component to this as well, which is that, where is it gone? Just lost it there. Okay. So this is alluding to last night's announcement. The government has said that, there's now not necessarily a restriction, but the number of people that you're allowed to engage with. So for people to stay at home unless they had to leave for essential reasons, if, for example, you're working in a court system where there's a court order to have contact, how should you navigate a situation like that?
Oh, gosh, that's a tricky question.
We might be able to get you some advice on that, because there's been unless you know, Jason, but there's been some people who are checking that out legally, and they were asking, the lawyers were asking, Aboriginal lawyers were asking the governments to reconsider that particular thing. And they're also requesting that if people are just are held on fines, could they please let them, last week they were asking them to let them home rather than come out in the middle of, in case the epidemic took hold in communities. So we will try and get you that information, unless, Jason, have you got any further advice on that?
Yeah, no, I think that's a good idea. As I said, these things change quick, and that rule around 2 people only got introduced last night.
Yeah.
Yep. And so another question is what do you see as the long-term effects for Aboriginal communities in light of COVID-19?
Well, it's very interesting, isn't it? I think it's a bit hard to tell what that is at this stage. I think it'll be interesting to see what's the long-term effect for everybody. And I think the students, if you keep up with your studies, and that will be really, really important for individuals. I think this is, what what Prime Minister is saying. It's going to take some time for it to pass. So I think we'll know a little bit more down the track, but there's no doubt that really the whole way we do business in Australia will change. I expect that there'll be new businesses being set up so that we produce the protective mask, and some of the things where we've got extreme shortages now will change, might bring back some of the manufacturing that used to happen here previously. I think, other jobs will change given how they've found they need to do things differently. I think the tourism will, everyone will start to go back and visit places again. It's certainly within Australia to start with. But it's sort of hard to tell, it's like we've been working on things that happen and change every day and within 24 hours. It's, and we've tried to identify every single thing that we'd need to think about, and we've done that pretty well, but who knows, I'm sure there's things that we haven't thought about that will come to light. But Jason might be better sort of looking into the future than I am.
And I suppose part of it also is this also attached to the question, which is, do you see anything changing in the way that Aboriginal medical centres function as a result of this?
No, I'd be surprised if they changed. Like, they have just been remarkable. And given my age, I can remember when AIDS first come about, and really our people thought of Condo Man and created Condo Man, and this time, this for. And it's funny, we never lose our sense of humour. Like, I saw somebody sent an email the other day, it's an image, Captain Cook on a stamp, and it said, "Here's our first pandemic." And so but the health services, what they've been doing is, several weeks ago, started by looking at, like, they came forward and said, we've got to close down communities. They've opened different entrances. Yarraba's closed, one of the first ones to close their borders down. So they will certainly, it's recognised that community control health services are pretty good. I've heard the minister say on numerous occasions, Greg Hunt, that that's a path we should follow. And certainly in the 10-year primary healthcare plan, he's looking at comprehensive primary healthcare for all Australians. That's what we deliver, and we've been pretty good at doing that. So will they change? I think they've changed rapidly, most of them, to dealing with COVID and how they set themselves up. But I'll hand it over to Jason from a clinical perspective. They might do more on telehealth, for instance.
Yeah, I think that'll be the main change. If we think about the Australian healthcare system, it's all been face to face all the time, and that's great. I think it's I wouldn't have been able to build relationships with community if I was on a phone. But there are times when it'll be better for the patient for them to just call up about something. So they've sort of opened up the door to that part of medicine now, and I think that we'll see people using that more and more. But at the same time, I can't see how we're going to stop doing all the face-to-face stuff. I think for a lot of people, having that yarn with the GP or with the nurse or with the Aboriginal health worker is really important. And so I think people are still going to come in and we're still going to do similar stuff. We just need to wait until coronavirus passes.
I think the area that it will improve is the access to specialists by remote communities who can't just, rock up. They have to get on flights to go and see them sometimes. So I think the telehealth, that could be a way of doing things whilst you're still might need to have them in person, I think that can help considerably people not needing to travel extensively as they have had to do in the past for specialists.
Could either of you talk more about telehealth and like what exactly is it and how do you access it? What are the specialists that you can access through that service?
I might hand that to Jason.
Yeah, I'll take it. So, this just literally got passed yesterday. So just today. And what happened yesterday is that they announced what they're calling universal telehealth. So what that means is that for most things that you could have seen a doctor for in the past and they could have billed Medicare for, they no longer have to see you face to face. They can see you either over the phone or via Skype, FaceTime, Zoom, whatever that clinic has set up. And then you can be seen and the doctor gets paid for that and you get bulk billed for it at the moment. And at the moment, they all have to be bulk billed services. So initially, it was just set up so that people that had coronavirus could call in first or were worried that they had coronavirus could call in before they came in, so to make sure they weren't exposing the clinic unnecessary. And it was also then for doctors that couldn't work for them to do it. But then yesterday we just said everything. And so that includes GPs, that includes Aboriginal and Torres Strait Islander health practitioners, practice nurses, specialists, psychologists, psychiatrists. Everyone can use telemedicine now or telehealth to see their patients. But how that ends up working, people are still figuring out, and it just depends on what's happening in your clinic.
There's a question here that is talking about some of our old people, and particularly the pensioners who are heading down for a Doris to Coles for Pensioners Hour to take advantage of that time slot to do the shopping, and some challenges around actually talking to our old people in staying home and just listening to the advice of being really cautious and taking it a bit more seriously. Could you share any advice about how we should approach talking to our old people to actually get through to them?
Well, we should definitely encourage them to do that. I noticed in today's paper, I think Tharawal in Sydney were in fact doing the shopping for some of the elders and were taking it home to people. So I think one of the big issues I certainly know has been a major worry, as I said earlier on, was stopping people from going to funerals. That's been a really big issue, talking to elders who just strongly believe it's respectful and the need to say their sorry business, and the older they get too, the more they're losing their friends to death. So I think we need to be very conscious about that. And we actually need, it might be something that we need to put out to our community control health services as well to be conscious about that. I think if we can encourage people to do more Aboriginal radio to get the message out, to make them, because I know a lot of them listen to radio, and that we actually, grandchildren and sons and daughters, try and do their shopping for them rather than, and they, we know they're missing out on company, but it's really important to get over this.
And there's another question here which is sort of piggybacking on that, which is that given that there is an isolation advice at the moment, and perhaps there's a lot of old people that are following that advice but now struggling to connect with family and culture, is there any advice to share on how to help our elders stay connected with family and culture during this time?
Well, I certainly know in some remote areas they're taking them out to some special, their special site to keep them away from the virus. I think I think it is fabulous listening in urban situations, in urban areas and metropolitan areas. It's fantastic to listen to Indigenous radio and Aboriginal radio and hearing some of that yarn and that talkback radio. Perhaps we need to encourage our radio stations to do more talkback radio because they would love that. And I just encourage family to make sure you're ringing them and talking to them on the phone. It will be really important for them to hear your voice.
Totally. Coming back to a really, really practical level in terms of the coronavirus, if someone is, if they feel like they have symptoms, or if someone in their family or their friends' network is contacting them because they feel like they've got symptoms, they call the doctor, but the doctor told them to just stay home. What's the advice, and what do they do as a result of that?
Yeah, I guess if that's the advice, like, I'm not going to counteract what the advice of the doctor is, I suppose. We're always entitled to get a second doctor's opinion. At the moment, we've got 4,000 odd infections across Australia, most of them in people associated with overseas travel. So if you are getting sick, at the moment, it's most likely it's something that's not coronavirus. If you haven't been overseas, or if you haven't been in contact with someone, it's most likely that. And so, that advice that doctor's giving you is probably based on that, that you haven't met the criteria for testing. So the best thing you can do is to stay home and to, just keep to yourself, like, just sort of treat yourself like you do have coronavirus anyway, and minimize your contact with others, because one of the things with the coronavirus is that we need to decrease the burden on the healthcare system overall. And so that means, not going into doctors if we think it's just a cold that we can get over ourselves. That said, if you're getting worse, I don't want anyone sitting at home just getting worse and not telling anyone about it. You know what I mean? So clearly, if you feel like this is moving beyond just your normal cold or whatever into something else, then you need to seek help about it soon. So, so people are generally getting that advice because there are a set of screening questions about what your risk is of coronavirus that includes overseas travel, contacts, and also where you live now, because there are certain pockets in Sydney where there's a bit of community spread. The general thing is follow that advice or ring up another doctor and get some different advice if you want.
Yeah. And this will be perhaps my final question, unless I see anything coming up in the chat after this, which is are there any other pieces of advice you'd give just in terms of precautions to stop the spread? Anything that you would say? I know we see on the news all the time, which is wash your hands regularly and so forth. Are there any sort of final pieces of advice in terms of precautions that we should be taking?
Well, I think before Jason goes in from his perspective, but I think what we all need to do is keep fit. You can do stuff in your house. You can do yoga. You can, if you've got an exercise bike. I think we all need to be making sure. It doesn't matter how young you are. You need to make sure that you keep yourself fit, eat healthy diets. If you're home, learn to cook if you can't cook. So it's pretty easy. Like, it's pretty good, but you do need to eat proper healthy food, etc. Now, I'll hand over to Jason for the clinical stuff, not the grandmother stuff.
No, that stuff's actually really important. There is even evidence to show that people that had a higher step count before they got coronavirus have a better survival. So, it's not just old grandmother advice. It's grandmother advice that has evidence to it. Look, I think the advice that the government has is all the accurate stuff. I think for everyone here, there's probably a lot of people who have aunties and uncles and grandmas and grandfathers, who fit into those age ranges where we're particularly concerned about them getting an infection. So it is really thinking about making sure that they're as protected as can be. So, that's why that advice around isolation exists. My sorry, I can't. Yeah, I'll talk about it soon. So my mum, she's got a really low neutrophil count, which is what your cells for fighting infection. And I just can't see her. And so you just
So you need to talk. So you need to make sure that you're ringing your family all of the time. Pain in the butt they are. Like, I got brothers, and a brother who we can't see because he's in supported care. He's got an intellectual disability, and we ring him on the phone, and he doesn't sort of understand what's going on. So we just try and say, and hopefully it's not going to be too long before we can go and see him. But that's really important to not only your family, but if you see your colleagues who are struggling, because not everyone can deal with these types of situations or deal with difficult situations. Everyone's different. So you just make sure you're looking after your colleagues, and, they might be older than you. There might be, so just need to keep a watch on each other. We're going to all get through this because we've got people who I've not seen anyone who's not putting their heart and soul into this. And on some other issues, I would think, I wouldn't waste the time of day with that mob. But on this issue, they are all pulling for everybody and trying to find amazing solutions to deal with it. So yeah, it's just remember that we all need a bit of help every now and then. And even those funny things like that Captain Cook's stamps, I'm still waiting for some more of that to come through, because our mob are the best mob to come up with, the most funniest, unusual, funny stories going. So, yeah.
Yeah, sorry, thanks for jumping in, Dawn. It is about just thinking about keeping each other well, and connected, and there is this real thing. There are people that are really high risk, and so just making sure we're keeping them safe.
So I might just take you back. I know we're going to end soon, but it was when I was at the National Museum, we had to deal with two traumatic events. One was a bushfire in Canberra, which a number of lives were lost, and we're able to bring people in and talk with people and open up and let them tell their stories. And the other time was, clearly this is much more significant, was when the planes went into the Twin Towers in the United States, and museums there in New York City opened up their doors to try and talk to children because Muslims, because they couldn't understand why rest of society was having a go at them. And the stories that came back around the world on what people were doing at that stage was to help each other and to try and make people understand and help them understand. So I think that's what we've got to do with everyone, saying, helping each other and think fun. Let's have some fun. And one of the most innovative things you can think of in terms of how you study, keep up your study. And it's really hard. Let me tell you, I'm at work because if I stay home, my dog comes to me. I want my dinner now, or I want to go out in the garden. And we're keeping huge space between us, those ones who feel that they're coming to work. And others are staying at home, and some are finding it really hard because they've got all the children there. But, that's okay. That's all right. I've said to staff that if you're not doing what you would normally do in your work, that's all right. That's okay. So, but I'm telling you guys, you've got every opportunity. You've got to keep studying.
Well, we really appreciate the time that you guys have given up to spend with us. As we've been talking beforehand, the situation is still unfolding, and we'll look to hold another session in the weeks ahead, which I've no doubt that we will. But all of your thoughts and words and advice is really appreciated by us. And I think that now it's one of those times where we sort of have to get behind and rally behind peak organisations such as NACCHO, and we really appreciate everything that you guys are doing for our mob, and Jason, all of the work that you've done for our communities, and like yourself, Dawn. We really appreciate it. Thank you so much.
Absolutely. Delighted to help. And if you need any more help, we're here.
And I see there's some questions that didn't get asked. I'll try and answer them in writing if you want.
Cool. No drama. If there are other questions in there, feel free to answer those, Jason, if you want to summarise them.
Oh, well, I was just having a look. I just sort of popped up. I just saw something come up. And so there was one, do you think this stopped suddenly in the same? So someone asked about soap and water because people were worried about hand sanitizers versus soap and water. And just to say that in some ways soap water is actually better. It's because the virus actually touches to fat, and the soap sort of gets fat molecules and stuff off that, and can get a bit deeper than hand sanitizer. So don't be worried if all you've got is soap and water. I prefer using it just because it's nicer. And then someone asked if there's plans to increase ventilators. There are flood changes to get more ventilators into regional areas. I don't think they'll get into remote because there wouldn't be the people to have the skill to safely operate them. And then someone asked about, will this bother stop suddenly like the Spanish flu when we all get vaccinated? It's expected that the vaccine won't be around for about 18 months from when it first started, so it will be a while off. And in terms of stopping suddenly, what people predict is that we get to a peak and then it'll decrease slowly. It won't be an abrupt thing.
Could I just remind people though that the flu 2020 shot will be available soon, and everyone should get their flu shot. It's highly recommended to get the flu shot, and if you've got nans and grandmothers and all of that, remind them to get their flu shot. It's really, really important.
Awesome. Thank you so much, Dawn. Thanks, Jason.
No worries. Thanks for having us. It was a real pleasure.
Thanks a lot. See you all.